But welcome everyone. My name is Kelsey Nyman. I'm the coordinator of student communications, and my main role is to keep you and your student informed so that they can be successful here. Tonight, we've partnered with the University Health Center with Sarah Jennings. Sarah Jennings is the interim director of the Student Health Center. Prior to arriving at Montclair 3 years ago, she spent almost 15 providing primary and reproductive health care in both New York City and Northern New Jersey, including several years running a full-service healthcare program inside New York City public health high schools. A former public school teacher, she is particularly interested in working closely with patients to help them take charge of their own health. She'll be sharing some safety and service resources, so give her a warm welcome.
Hi, everybody. Kelsey, you can confirm for me you can hear me okay, right? And see my screen?
Yes, I can.
All right.
And for anyone, we will be taking some questions at the end, and this webinar will be recorded and sent out at a later date. So hold your questions to the end, and we'll be happy to answer them then.
Okay. So thank you so much for everybody for joining us tonight. I'm gonna give you kind of just a really basic overview of the Student Health Center. Um, and hopefully be able to answer most of your questions. So first and foremost, our goal at the health center is really to support your student to be kind of healthy in, mind, body, and spirit so they can focus on their studies. And to that end, we really try to make everything as convenient for the student as we possibly can. So we are located inside Blanton Hall, which is one of the dorms. So we're kind of tucked away in this space here, and oftentimes we hear from students like, "Oh, wow, we never knew you were here before," or they come inside and they say, "Oh my goodness, this place is so big." So we really are kind of we function like a full service doctor's office. We're staffed by nurse practitioners and registered nurses, and then a team of residents 1 day a week. And so we're kind of tucked away in Blanton Hall, right there on the first floor. Um, Everything, just like I said, we function like a regular doctor's office where everything inside the health center is completely confidential and we follow all HIPAA regulations. So keeping anybody's medical information completely confidential, even though we are a part of the university, that information does not get shared with outside doctors, with other university staff members, unless that student gives us explicit consent in writing. So, like I said, we're staffed by a team of nurse practitioners and registered nurses. And once a week, we have a team of resident doctors who are there. For the most part, we work by appointment, really, so we can kind of filter students and direct them towards the right type of provider, depending on what's going on for them. That being said, we of course take walk-ins if someone is really feeling unwell. The nice thing about us that is not like a typical doctor's office is that we will really do our very best to get that person in that same day. Um, but for the most part, we do work by appointment. If your student is under the age of 18, you have not done this already, in order for us to provide care to that student, we need their parent or guardian to give them consent in their My Health portal. So if you have a 17-year-old and that is not familiar to you, reach out to them and make sure that we get that signed because we really are not able to treat them without it. Um, we also just another kind of like, housekeeping type things before students come in. We ask that they fill out a full health history form and they give us our consent before we treat them. Part of the reason for that is sometimes family members want to kind of help them fill that out because they're able to tell them about any pertinent family history that we need to know about. Sometimes students need a reminder about dosages of medications that they're on. And it also really just allows us to spend kind of the full visit focusing on the issue at hand as opposed to going through paperwork with them. We make a real effort at the health center to be as inclusive as possible. Every single one of our staff members is safe space trained. So what that means is that we've all undergone a workshop, oftentimes several times, that aims to reduce often unwelcoming and even hostile environment in which LGBTQIA people navigate their daily lives. We really make it a priority to make sure every single student here feels welcome by us when they come seeking care. Oftentimes, this is the first time students are trying to take care of their health on their own. So we want it to be as positive an experience as we can. Our staff has also all completed a training in mental health first aid, which is kind of a geared towards both healthcare professionals, but also just really anyone to help identify signs and symptoms that maybe need some more attention when it comes to people's first to their mental health. So I'm going to run through some frequently asked questions. First of all, what does the health fee cover? So to be seen at the health center is completely free. We never charge for visits. It doesn't matter if your student comes to see us every single day of the year. We do not charge for them to be seen by a provider. We don't charge copays. Um, Now, we will see students no matter the type of insurance they have. So a lot of the times people are under the impression that they're only allowed to come to us if they've opted in to the health insurance through the university. That is not true. We'll see anyone. It doesn't matter if they are uninsured, if they have private insurance, if they have Medicaid. Insurance really doesn't matter. We really are there for any Montclair student. There are occasional in-house fees that we sometimes charge. So say, for example, a student comes in and we've diagnosed them with strep throat, and we need to give them penicillin. So one option will be we'll send a prescription to a local pharmacy. We work closely with a local pharmacy and they will then deliver the medication to the student's dorm on campus. And that way we can run it through their insurance and there'll be no charge. Um, the other option is that sometimes students really just want to walk out of the health center with that medication that they need in their hand. If they prefer that, there sometimes will be a charge for that medication. It goes onto the student's Nest account. But we always talk through students, walk them through those options. So how does a student go about using this service? Like I mentioned, we really do prefer students to call to make an appointment. Again, we're trying to keep our waiting room kind of flowing as much as we possibly can, just so students aren't missing class, they're not late to class, and also just to reduce exposure to illnesses. Um, let's see. So do you have an infirmary where students can stay if they're sick? So some universities, if someone really needs kind of medical attention 24/7, will be able to admit them. We don't have that type of infirmary on our campus. We provide services during the day, Monday to Friday, just like I said, like a primary doctor's office. So oftentimes we come run into this question where a parent understandably wants to talk to us about an appointment that their student has had at the health center. Because we are a regular medical office, we do have to follow HIPAA regulations, which really means that once that student is 18 years old, we cannot share information, even with their parent or guardian, unless the student has put it in writing for us, which is a big adjustment once you send your student to college and you've been used to kind of helping them navigate their healthcare their whole lives. It's a big change. Um, Partly, though, what we notice is this really does help to teach students kind of how to manage their own health, to follow through with picking up a medication, how to call and make an appointment. So really, there's a lot of benefit to it. But again, if there is something that really we need to partner with the family on, which happens all the time, then we'll have that student sign a consent form to give us permission to speak to you. So this is the first time my student will see a new healthcare provider. How should I prepare them for the first visit? So it's important for the student to disclose their personal health information during the visit. The student will need to be able to identify medication allergies, including reactions to medications, names and doses of medication they may be currently taking, and personal medical history, as well as family medical history. Again, them filling out this medical history form before they come to campus or before they come to see us. I mean, it's available right now if you think they may not have filled it out. That's an opportunity for you to go over with them and put little reminders. Hey, put this in so you make sure so you don't forget to tell the person. Um, but it's really kind of disclosing their history, getting used to remembering what medications they take, remembering that, oh yeah, I had this surgery a couple of years ago. So I've mentioned my health portal a couple times. My health portal is the way that we often communicate with students. They can submit their immunization records. They can message us securely from that system. We're also able to release lab results through that portal. So it's kind of a secure way of us communicating with a student about their health history. And if there are often questions about submitting immunization records, so please, I'm happy to answer those at the end. So what services do we offer? So we're basically a primary care office. So we provide physicals for students. We do blood work. We write prescriptions. And of course, we do sick visits and injury visits. So if someone has a headache that won't go away, or their throat hurts, or they've twisted their ankle, we of course take care of those things. We have all sorts of basic first aid. But we also do EKGs in the office. Like I said, we can do blood work to check for anemia, high cholesterol. We provide comprehensive sexual health, so screenings for infection, birth control, emergency contraception. We do provide hormones for transgender students and just kind of a full spectrum of care geared towards LGBTQ plus students. We provide PrEP, which is a medication for individuals who are at risk for HIV to prevent HIV infection, and also provide PEP, which is a medication that can be given after an exposure to prevent HIV. We, with what's going on kind of in the world, mental health has really kind of come to the forefront of what we focus on. So we screen every single student who comes in for depression and anxiety. And we do provide some limited treatment for those things as well. We have a wonderful counseling center on campus, of course, that we work very closely with. They probably will be offering a similar session if they haven't already. But that is incorporated into the care we provide because, of course, physical and mental health are so closely linked. I mentioned we do employment physicals, sports physicals, routine physicals. Immunizations we give. We're giving free flu vaccines, so encourage your student to pop in and we'll get them out of there in 5 minutes to get their flu vaccine. We also provide a self-help area out in the waiting room, so Motrin, Tylenol, allergy medications, that kind of typical stuff that people may need on a day-to-day basis and they can't access a pharmacy. We provide that for free out of our office, no appointment needed. We also have those products in a vending machine we call the safe that's located in the student center. We have some limited availability for providing allergy injections, which is really great. It's pretty unusual, I'd say, that most universities don't offer that service, but we have two nurses who have been doing it for a very long time. So if that's something your student is interested, please give us a call to see if we can accommodate that. Great way to get a hold of us, parents too, but for students is the Ask a Nurse email. We put a lot of effort into returning your emails and also to returning your calls. I would say we're proud of our reputation on campus as getting back to everyone who calls us. We really, again, try to prioritize that. And then again, often we have students who have chronic illness or there may be something going on that really requires specialty care. We, of course, will provide referrals to off-campus providers if need be. There is something called the Red Hawk Ready Medical Alert, which is to assist the University Police Department and our own EMS department to assist and accommodate a student in case of an emergency. So you can go to any of these locations below, or your student can, and apply for one of these, and it's a special sticker that goes on their ID card. So in the case of an emergency, University Police and EMS, if they can't communicate with the student, they can see that sticker on the ID card and look for the medical alert. So it just kind of helps to facilitate and speed up care in the case of an emergency for students who may have an ongoing medical issue. So that kind of in a nutshell is us at the health center. I am happy to answer kind of any questions or to clarify anything that you all want to talk about. So let me know what questions I can answer for you.
Hi. Real quick, I know you mentioned that there's a thing called the safe that is in the student center, but that
Mhm.
you also have a self-help area in your waiting room.
Yep.
And that's, like they can purchase the stuff, whatever you have there.
So
Or-
I'm sorry, go ahead.
No, no, no. Or does it get charged to their Nest account? That's what I was trying to figure out.
I see. Okay, so in the waiting room, that stuff is free. We just
Okay.
provide that.
Oh,
We don't want somebody, I have a headache, so I have to walk to the store and buy a bottle of Motrin. We want them to be able to swing by, grab some Motrin, and get on their way. So all those over-the-counter medications are free, and it's things like we have menstrual products, like I said, Tylenol, Motrin, allergy medications, Pepto-Bismol for an upset stomach. And that just comes self-serve. You grab it, there's no charge. And that's during our business hours. So that's from about 8 to 5:30. The
okay.
safe, which is the vending machine in the student center, just we were trying to make those medications available kind of for longer hours. There is
Hmm.
a charge out of the vending machine, but we've really made the cost is what it costs us. So
Okay.
they tend to be much more affordable than it would be if you went to CVS.
So you said 8:30 to 5:30 Monday through Friday, or what about weekends?
We're not open on weekends. So
Okay.
again, yeah, that's where that vending machine might come in handy if someone really, they're not feeling well and they need some ibuprofen. Um, yeah, but we're only Monday to Friday.
There's a question in the chat. Where can a student go on weekends?
So we have, first of all, we have our own EMS service. So just rest assured, if there's something that really needs medical attention over the weekend, students should, and they certainly do take advantage of that. Um, You know, like I said, we sometimes get students who call us on a Friday afternoon and they really don't feel well and we're approaching the weekend. We will make every effort to get them in on Friday because we know if it's Saturday and they wake up and they feel worse, we're not going to be open. There are several urgent cares that are, 10 minutes from campus. So oftentimes students utilize those if they really need to. But again, we work hard. So, Fridays and Mondays are often pretty busy for that reason because typically, unless it's a real emergency, we can kind of work with them on those days outside the weekend. Let me pull up the chat.
I can help you.
Can you help me out? Thank you.
So another question is, I saw someone also, their daughter is going to be coming to the health center on Wednesday to begin allergy shots. So
Oh,
that's
great. Okay.
my question is, if my student is out sick and gets a return to school letter, who should get this letter?
So during COVID, we were very, when there was a very strict isolation policy, those letters came through the health center and we would communicate with the dean of students. We don't do that anymore. So really that student, if say the student is going to miss a couple days of class, that student really should be encouraged to work directly with the professors. Professors are really try to be accommodating of students. In the case that there's an issue, or let's say there's going to be a longer absence, you should communicate directly with the dean of students, and they will kind of help get a plan in place for your student. But we don't require a return to school for kind of, a kind of acute illness where they're going to be back in a couple days. Let's see.
Going to drop the Dean of Students contact in the chat for you all if
Oh,
you
thank
ever
you.
need. Next question. Does the local CVS pharmacy make deliveries to the school for routine prescription medication?
So the CVS does not deliver. If your student is on a daily medication, typically what we have them, we encourage for them to have their provider send that prescription to one of two pharmacies. One is, and I can type them in, is Clifton Pharmacy and Compounding Center. We work with them all the time. What they will do is they will call the student, say, "Hey, our delivery person's going to be on campus between 3 and 6. Can you make sure to be in your dorm?" They will pull out front of the dorm, text the student. The student can run down and get the medication. Again, just trying to keep it as easy as possible. So I'm going to put that one in here. And then there's a second pharmacy called Montclair Pharmacy that will do the same thing, and I'll add them as well. The closest pharmacy walking distance, if ever someone needed to do that, would be Montclair Pharmacy. It's about a half mile from campus, but they do deliver. So that's kind of would be the wouldn't happen that often that someone would need to do that.
Next question is, do you provide referrals to specialists when required?
We do. We do. We do. Well, and again, we're trying to kind of strike the right balance between helping students when often this is the first time they're really taking charge of their own health, but also understanding that the healthcare system can be really complicated. So we often will not only provide a referral, but we will sit with the student and pull up a list of different specialists that accept their insurance, walk them through the process of making that appointment. So often it's not just handing them a referral. But we do, we have a list of providers of specialists that we tend to refer to. Um, so absolutely, we do that. Yeah.
Great. Next question, if routine blood work is ordered by their physician, can it be done at your health center?
So that really depends. We don't function like a lab. So if a provider sends the student to have blood work done for us, done with us, it's not automatically going to get sent back to the provider from Quest. So we work with Quest and LabCorp. So sometimes it's a little bit of an indirect route to get those labs back to the person who is ordering it. So we don't do that routinely. That being said, we have students on campus who, for whatever reason, they may have a chronic illness, and they're on a medication that requires monitoring and need blood work drawn once a week or once a month. We don't want it's a real hardship for that student to go back and forth between a lab off campus. So in those kind of special cases, we're absolutely happy to do that. I hope that answered that question.
Those were all the questions in the chat for right now, unless, oh, just got another one. Curious, as the comment earlier about beginning allergy shots, the center provides treatment plan, question mark? Of so, what kinds of allergies, food or seasonal?
So, yeah, so no, we don't staff an allergist. And so when someone is beginning allergy shots, either for food or for environmental allergies, that plan needs to come from an allergist specialist. And we don't create that. It's a very kind of complicated, it's a very precise plan. And so we wouldn't generate that. What happens is that student, we could refer them to an allergist. And then once that plan is in place, we could then initiate the shots for them.
Any other questions from anyone? Feel free to unmute yourself or type in the chat.
I'm going to put my email in here in case, like me, anyone gets shy on Zoom meetings or you think of something when you get off. But please feel free to email me.
I had a quick question
Mhm.
about the CVS. I was the one that was asking about them delivering.
Mhm.
So didn't know this, so I called them today, and they have on their app that they do deliver, but there's a charge. So now I'm worried tomorrow, like where will they show up? Will they? I mean, they have her phone number, so when they come, I mean, and they also charge $10 for delivery. Do these other pharmacies that you recommend charge for delivery? No, right?
They
Yeah, that's what I
don't.
thought. Okay.
Yeah. And that's news to me that CVS does that. I mean, I guess it's always nice to have that option.
Mm-hmm.
The other pharmacies don't charge. As far as where this medication will go, I would call just to be sure in
Yeah,
the
I
morning
will
and make
call them.
sure. Yeah.
Mm-hmm. And then
Yeah.
future, I'm going to transfer it over to, because it's a monthly thing. So I'll call Clifton or Montclair and see if I could get the doctor to switch the
Yeah.
scripts.
Yeah, I think just that process runs pretty smoothly with those two pharmacies. So I think that probably will make your students' life
Yeah.
easier.
And they
Um,
also said they had a plan for $5 per month, CVS. If you join their club, pharmacy delivery club,
oh,
charge $5 per month or, $60 a year, whatever it is. They'll deliver for free. It's not really for free, but I guess as many times during the month that you need them
right.
to come, the $5 would cover it,
Huh.
is what they. I have to call back again and make sure I don't want to give false information.
Yeah, no, no. I'm gonna investigate a little bit because I we always, it's always good to have a third option, even if it's kind of an imperfect one, So,
Yeah.
but thanks for sharing that.
Yeah. Thank you.
I'm also going to share our generic email in the chat where if you have any questions regarding this webinar or not, you can always ask there. Any other last minute questions?
No, this is great. Thank you very much.
Thank you for joining.
Yeah, thank you so much for coming.
Yeah, it was helpful. Thank you.
Yeah, thanks for coming. And like I said, shoot an email over to me if anything occurs to you later.
Great. Thank you.